But the goal here is to bring in a heavy hitter. And so today, my guest is Dr. Gary Glassman. Dr. Glassman is out of Toronto, Canada, well-known endodontist, wonderful clinician, incredible teacher and lecturer, puts on hands-on courses all over the world. And he's someone that really inspires me to be a great endodontist as well. He's been a great friend to me, a great mentor. And so I'm excited to have him join us. Let's see if he can find his way into us. Let's see here. He's trying to get on. So let's see if I'm here. So, 3 questions with Dr. Brett Gilbert. I asked 3 questions. There he is. Dr. Gary Glassman joins us here live. Super excited for this new segment where we introduce some brilliant clinicians from around the world. In this case, more than just a brilliant clinician, a brilliant businessman, brilliant practitioner, lecturer, teacher, certainly a mentor to me, an amazing husband and father, but most lucky for me, an amazing friend of mine. So, Dr. Gary Glassman, I really appreciate you joining us for the very first 3 questions with Dr. Brett Gilbert. And so welcome.
Thanks, Brett. This is great. You know, I feel like I'm with Jerry Seinfeld in having coffee with comedians in cars today.
There you go.
I'm live from Toronto, Ontario, Canada on this beautiful sunny day, as you can see, just running errands, which is a rare thing for me, being out of the office and getting to join my best buddy over in Chicago. So hit me with the 3 questions, Dr. Gilbert.
All right, let's do it. Okay, so Dr. Gary Glassman, question number 1. What was your moment? What was the aha, wow moment when you said to yourself, I want to be an endodontist? Tell me about that moment.
Wow, that aha moment. I have to say probably occurred in my 4th year of dental school when I was looking to see what I wanted to do. Did I want to go into general practice? Did I want to specialize? If I wanted to specialize, what specialty did I want to go into? So I was really, bent on going into oral surgery. I loved extracting teeth. I was going into the operatory with my mentors at the time, watching crazy Lefort 1 osteotomies and all kinds of wisdom tooth removals. And I figured this was for me. And get back to dental school, and I'm ready to, work and apply for specialty programs. And a patient came in pain, and we decided we were going to embark on root canal. So my instructor said, okay, Gary, this is it. This is going to be your moment of truth. You got to get this patient out of pain. So we anesthetized the patient, opened up this tooth. It was a maxillary first molar. And up until then, I really hadn't treated really any molars. I was doing premolars, anteriors, opened up into the tooth. I felt like a pro. And all of a sudden, I took my file, and the first root canal, the first canal I actually slid into was the MB2 canal. Oh. Imagine that. Sliding into an MB2 canal right out of the hop, first molar. And I started filing this tooth, and bleeding stopped, and the patient was out of pain. And I filled this canal like I was out for 20 years. And I decided at that moment, man, I want to do root canal treatment. I love it. I want to do it. I want to embark on it. So I applied to endo school, and a year later, after practicing for a year, because that was the mandate in Canada, I got into endo school, and the rest is history.
Wow.
The MB2 canal moment, bro.
Wow, it's like hitting a grand slam on your first at bat, right?
Unreal.
Yeah, and then you've taken that forward, and you've treated thousands of patients, you've taught thousands of doctors. So from that moment, you've really done a lot to advance our specialty. So awesome first moment. I love that.
And I have to tell you, ever since then, I've had a love-hate relationship with the MB2 canal.
Right, as have we all, for sure. Okay, Dr. Gary Glassman is joining us here. 3 questions with Dr. Brett Gilbert. First question: when was the moment you wanted to be an endodontist? Gary got a patient out of pain. Now, number 2, Gary, what gets you up in the morning, gets you excited, gets you enthusiastic about going in and doing root canal treatment in your office?
Brett, it's the challenge every day. Every day is a challenge. Every tooth is different. And when we look at root canal treatment, we're looking at anatomy. And with all the technologies that we have, with cone beams, with ultrasonics, with microscopes, it allows us to treat the teeth more predictably, better, so we can satisfy the objective of dentistry, which is to obviously have the patient keep their keep their teeth for a lifetime. But what gets me up in the morning and what is never going to change with respect to what we do is the anatomy of the root canal system. And that's what interests me. That's what piques me every day to allow me to get up and say, today's not going to be a boring day because I'm going to see something today that I haven't seen yesterday and probably will never see again.
Wow. That's sweet. That got me excited, man. Wow,
Yeah,
that is
sure.
awesome. Great way to put it. Great way to put it. Okay, so again, 3 questions with Dr. Brett Gilbert. Gary's answered 2 of them. Why you want to be an endodontist. He got a great patient out of pain. He's challenged by the endodontics and the anatomy. That gets him out of bed every morning, gets him psyched up. So Gary, tell us what you feel would be the future trend. What's coming down the pike? What's needed to really advance our specialty further in the future?
Well, what's needed, what's happening right now, and what's going to advance us to provide even more predictable outcomes is obviously, I know, is debridement, irrigation. It's all about providing the most disinfected root canal system that we possibly can to allow the body to heal for that particular individual. Once again, satisfying the objective of dentistry, which is to allow the patient to keep that tooth for a lifetime. And of course, I have a question for you. You ready for question number 4?
Absolutely, hit me.
So we are so focused right now on the oral systemic relationship with respect to our oral cavity, inflammation within our periodontium, and how it affects other parts of our body. And so much right now is being focused on teeth, root canal treated teeth. I would like to know from you, what do you find the health benefits of a patient that requires root canal treatment?
Well, let's face it, the oral cavity has been shown, and you've been a huge advocate of oral health care globally. I know you've done a lot of amazing work in spreading awareness, helping to educate in different countries. And so, yes, the oral health is incredibly important, probably primary to our overall systemic health. And certainly a patient that carries infection and infected tooth, obviously there is an issue with access to care in this country, the United States. I'm not as familiar in Canada, I have to assume as well, and certainly globally. So a patient with an infected tooth, you try to nurse it along as you can. That infected tooth and abscess can actually be fatal in the worst possible case. So addressing infection in the mouth is incredibly important. Periodontal disease has a very detrimental effect to our cardiovascular health and many, many other areas of our health. So there's no question that root canal treatment allows us to safely and successfully save a tooth that's diseased. And there are obviously varying states of that. Obviously, currently in the popular medium, there's been a lot of talk again about different, really refuted, unproven theories that root canal treated teeth can make you sick. And the truth is that for those that really understand evidence and science and have looked at it, the truth is that we know that root canal treatment is safe. It allows you to maintain a tooth that would have been extracted for other reasons. And so I want the public to know that we stand behind the endodontic treatments that we do, recognizing that a well-treated tooth that's restored properly can last for the rest of your life, as long as you take responsibility for taking care of that tooth, brushing and flossing it. And so to answer your question, Gary, yeah, the mouth would be the perfect place to start for someone who's committed to improving their overall health and going to visit their dentist.
Very well said. Excellent answer. And I believe in saving our teeth one root at a time, baby.
Yeah, man. Okay, so 3 questions with Dr. Brett Gilbert. I brought on my heavy hitter, Dr. Gary Glassman. I'm so grateful for you, buddy, for everything you give to me as a friend and as a mentor. I thank you for being my very first guest. I will be posting this on my IGTV channel. It will be live on the storyline for the next 24 hours. If anyone has any questions, follow-up questions for me or Dr. Glassman, please private message me. Gary, go enjoy your day off. I appreciate you doing this for me, man, and I love you.
Okay, bro. Love you too. Have a great day.
Take care.